My name's Leanne Bloom, and I'm the owner of Oak Bloom OT here in Oakland, California. And I've been speaking with a lot of parents recently, especially this week, on sensitive children. We're raising these kids that are extremely sensitive, and I'm raising one too. And I understand as a parent what it takes to raise a child that has extra sensitivities. That means if they're not getting something right, they cry, they're angry, they start throwing things. What do we do as parents, educators, professionals when a child is reacting in this way to a developmentally appropriate task that we're asking of them, such as writing your name if you're a 6-year-old, or doing some basic stretches like as we were doing a downward dog and there was tears. And there's another situation where a family came to me and the child is unable to watch shows like Pikachu, for example, and they're 6 years old. And that's getting in the way of their social ability to be in play date that might have a screen, such as that. Or sometimes a rainy day and the teacher wants to put on a fun little show and this child cannot deal. And how does an occupational therapist even work with that? Well, I work with sensitive kids, and when we're working with sensitivities, we're thinking about the whole picture here. As an occupational therapist, my job is to break down what's getting in the way of them being able to access their occupations. The child wasn't able to be in the classroom during a free choice movie time. And that is problematic for that child and that family, that school, that teacher. So, what do you do? Well, as an occupational therapist, we want to break down why that sensitivity is occurring. Maybe there are other sensations that are impacting them. And so you add one more sensory experience and it's just overwhelmed and they cannot any longer. What we do is we teach them adaptations and techniques, whether it be social communication techniques, such as communicating, I feel overwhelmed. I don't want to do this. This feels hard for me. Can I do a different activity? Maybe giving some choices for that person to be able to advocate for themselves, but then also for a teacher or parent to be able to acknowledge that in the child and be able to provide other options for them too. So, for example, can you read instead? Can the child read instead? Can the child go and put their head down on the desk and not watch the show that the rest of the class is watching? Can the child take a break from the play date and go and get a snack or go play outside for a few minutes and come back? And then the other technique is to slowly introduce them to these things that might feel hard for them. And that goes across all areas of occupation, but especially with sensitive kids and sensory sensitivities, using this screen as an example is gently exposing them to the activity in a controlled way, in a way that feels like they have control and that they are having a positive experience with it. So you may pair with a hard activity with something that's easy. You may pay attention to how they're reacting in those moments that you're pushing them forward. Are they reacting in a way that's tensing up and they're pulling their body away from the stimulus? And those are moments to just watch for and almost track how long they're engaging in those kinds of nonverbal communication with you and how long they can sustain that. And then how does it escalate? Is it getting more and more intense for them? Are they starting to display other types of behavior like throwing, hitting, shouting, running away? Those would be in added levels of intensity. So you want to be paying attention to that and being able to adjust as needed. to their sensitivities.